the station that's on your side. This is Channel 7 News Daybreak.
All right, 6:23 is the time as we celebrate February Heart Month. Let's talk about some common causes of cardiovascular disease. It's high blood pressure. It actually contributes to 1,000 deaths per day, folks. Here to help lower those numbers, Baptist Health cardiologist and our friend Dr. Anthony Fletcher. Dr. Fletcher, good morning.
Good morning.
Hey,
how are you?
I know you were on call last night, so thank you for being up early with us this morning.
Well,
but this is so important because this is the month of awareness. We like to talk about it. You were part of a call-in last week. I'm sure you got plenty of questions about this. Tell us a little about some of the causes of high blood pressure, and I know the numbers were changed recently in the last couple of years, so help us break down these numbers this morning.
Good. So you remember that.
I do, yes.
Well, certainly hypertension, the numbers did change. The new norm is 130 on the top and 80 on the bottom, so we want those numbers 130 over 80 or lower. So that creates a larger percentage of the population who we formerly call hypertension. That was changed because we looked at what happened to people who had numbers that were 135, 140. They seemed to develop problems. 1 out of every 3 Americans have hypertension, and that's just an awesome number.
Yeah, 33%.
Absolutely.
That's, I assume, grown over the last couple of decades,
It certainly
right?
has. It certainly has.
It wasn't that way 20, 30 years ago.
Right, it wasn't. And, why? That's the question. And so that's what we'd like to talk about this morning. Our society has become increasingly less active. So we're sitting down at the computers. We're doing less exercise. We're eating fast foods. We're supersizing. These foods are very high in salt and sodium. And there's lower intake of potassium, and sodium and potassium kind of play a role. The lower the potassium, the higher the sodium. And so things that we eat are certainly loaded with salt. We have a lot of hidden salt. If you look at some of your prepackaged meals, such as lean cuisine, for example, if you're trying to use weight. Canned soups, canned vegetables, some of these quick casseroles we put in the microwave, those are, again, high in sodium content. Just things that we don't think about, like dill pickles and olives. We look at things certain like soy sauce and certain salad dressings. They're very heavy in salt.
And those are things, too, that you might think, hey, I'm eating healthy. I'm eating pickles with this or some of the other things you mentioned.
You have a salad.
Yeah, I have a
salad.
salad.
Up with all those things. Absolutely.
Right.
Correct.
You go heavy on the dressing, all of a sudden it kind of defeats the purpose, right?
As far as your blood pressure is concerned, absolutely.
All right, so about 30 seconds left. Let's talk about things to do to maybe help lower that blood pressure. I'm sure it starts with the traditional diet and exercise. What do you really mean by that?
Absolutely. The first thing, though, is that you need to know what your blood pressure is.
Is you right? Yes.
Get it checked. Absolutely. So there are many ways you can do that now, and there are even home monitors, which I highly encourage people. The second thing is to know the fact that there is potentially a risk for hypertension in your family.
Okay.
Exercise. You want to do aerobic type exercise or light resistant type exercises. Watch your sodium intake. We really suggest now you take 2,000 or less milligrams of sodium per day.
Okay.
So watch what you eat. Look at the labels. Now, a lot of foods have the amount of sodium that are listed on those labels. And then again, you want to be just very active and very, very into looking at what you're eating. Watch your blood pressure. If your pressure's high, modify your diet. Go visit your doctor, get your pressures checked. And don't be afraid of medications. A lot of people don't want to take medications. Sure. If you have hypertension, you want to treat it. The main reason you want to treat it, you want to avoid the major complications. The big complications, stroke, heart attack, and renal failure. And
that's where you come in. Hopefully they don't have to come see you for that, but if you do need to go see Baptist Health, you can call the number anytime on your screen, baptist-health.com. And if you need to see a cardiologist, ask for the cardiology team over at Baptist Health, and they'll take great care of you. Dr. Fletcher, thank you again for coming in.
Good morning. Thank you.